we still have women who give birth at home. These women mostly want to give birth at home because it's a traditional belief, and they also want to hold on to their beliefs. And also because of their previous experience in the hospital. You go to the hospital and maybe your previous delivery wasn't really as smooth as you thought. Having harsh nurses, harsh medical personnel, maybe the environment wasn't conducive, and you just had a really uncomfortable delivery. And also because of proximity to the hospital, the distance, it becomes a problem because sometimes you find they don't have the means of transport to get to the hospital. Sometimes they cannot afford to hire a car to take them to the hospital. It's costly. When there is a midwife, a traditional midwife, who's helped women give birth severally, you're like, she can do it. I mean, it used to be a common practice back in the days, but right now there are a lot of diseases which makes it a whole lot riskier giving birth at home for both the mother and the child. She could get sepsis, which is an infection, and most of the time sepsis is fatal. It could lead to both the child and the mother's death. There is asphyxia. Birth asphyxia is also one of the complications. The mother can get tears. When she gets tears, she needs to have them stitched. If she does not get stitched, they may develop into fistula, and that becomes one other health condition for the mother also. There's a belief in my community that you just don't give birth in any house. You give birth in a thatched house, the grass house, And since these women are really convinced that giving birth in a thatched house is safe for them, I believe we can improvise, create the thatched houses, but inside it, we equip it with modern medical facilities. That way, it is safe for the mother and also to her liking. And we bring in the midwives as much as we also bring in the medical personnel. That way, the mother feels she is in an environment to her liking, and seeing the midwife there makes her comfortable, and together we can be able to save the mother and the child.